studying the efficacy of virgin coconut oil as possible treatment for COVID-19 patients. But Cabinet Secretary Carlo Nograles believes there's no harm in trying, even distributing this to some hospitals. Let's get an update from one of the leading researchers, Professor Fabian Dairit from the Ateneo de Manila University. Thank you so much for joining us, Professor. With the slow vaccination drive, more people getting sick of COVID-19, more of our kababayans are looking for alternative medicine or alternative means to basically fight this virus. Can virgin coconut oil decrease the symptoms in COVID-19 patients?
Yes, we can say that based on the clinical study that was already done. And I'd like to correct it. I didn't do the clinical study. It was Dr. Agdepa at the Food and Nutrition Research Institute that actually did it, but we helped design the study. But it showed that if you take VCO versus control, and this was a double-blind, placebo-controlled clinical studies, it's what you would say the highest level of clinical studies there is. Even at day 2, the number of patients showing symptoms decreased by about 20% already, versus the control, which decreased by about 3-4%. And then by day 4, 1/3 of those taking VCO symptoms had decreased. So clearly, the symptomatic relief is there, and this was supported by studies on the blood, what they call the C-reactive protein, which measures inflammation in the bloodstream. So there is evidence that VCO does provide both symptomatic as well as relief from inflammatory conditions.
So Professor, it has been a year since the lockdowns, and more than 15,000 of our kababayans have perished because of this virus. If the evidence is there, Professor, why hasn't it been used in hospitals and for medical usage?
Well, of course, first of all, it takes time to do the research. This particular study was a 28-day, clinical study. So it's really the first step, and this is on mild and suspect cases. We hope to bring this up to more serious COVID patients in the hospital, but that needs to be done, eventually.
So Professor, where are we at in terms of clinical trials, and how soon can it be used?
Well, I think, first of all, it can be used now, although you cannot make the actual claim that it will cure you. But, there's a lot of anecdotal evidence, but you still need to do the clinical trials. And it's what we call a functional food. So you do not need a prescription to do it. That is a big advantage of VCO. And in fact, if VCO is not available, you can just take, gata. But you have to take a bit more of it. There's a measurement you have to do. So it can be taken, and people have reported symptomatic relief already just taking VCO.
So Professor, tell us, what should be then the intake of virgin coconut oil for COVID-19 patients? How many times should they take it per day?
Well, the usual recommendation is 3 tablespoons a day, and you take it 1 tablespoon after each meal. So, breakfast, lunch, and dinner. Now, if you have mild COVID, then you can increase that to 2 tablespoons after breakfast, lunch, and dinner. So 6 in total. So that is the recommendation. But then you still need the clinical trials, with more strict measurements to actually pin that down.
Absolutely. But can individuals with comorbidities or pre-existing medical conditions also take it?
Well, that is one aspect that needs to be studied further. There are many comorbidities, by the way, so you really cannot generalize. So there are those with diabetes, heart conditions, cancer, and so forth. So I guess individually, you really have to go through it in order to actually recommend it, for clinical use. So those are some of the things that need to be looked into further.
So Professor, what is the next step in your view for virgin coconut oil, or VCO? What should be the next step for it to be used in hospitals?
Well, certainly the clinical studies still need to be done. This is like a championship game series. We've won the first game, so you need to win 4 out of 7. So we're on the way, and I think the request now is to really push more clinical trials and to recruit more patients. Funding is needed to do that. So I think what we're asking for is really more opportunity to study the VCO. And as you said, the comorbidities have to be studied. To whom, what type of patients can you recommend this? And those need to be established.
And before we end, using the basketball analogy, you said that we won game 1. Are we closer to winning games 3 and winning the championship?
I think we're well on our way. I'm optimistic that we'll get there. But we need the cheerleaders like yourself. So you're the cheerleader. So please cheer for us.
Thank you so much for joining us on Newsnight. Professor Fabian Dairit, President of the Integrated Chemists of the Philippines.